Welcome to Thoughtful Thursdays. Today is with us Dr. Mohamed Hanafi, family medicine consultant. Hello, Dr. Hanafi.
Hello, Dr. Tariq. Pleasure to see you.
Thanks for making time to be with us here today and to share some of your thoughts about getting older in regards to people's health.
Thank you very much. Thank you.
What can you tell us about that in a general way?
As we get older, we become more susceptible to catch up infections and also to develop some diseases, mainly the chronic diseases. Let's start, for example, with osteoarthritis, or in broad terms, wear and tear of the joints. Of course, when we get older, we start to get our joints becomes more affected, and this might affect our mobility. So if someone develops knee wear and tear or hip wear and tear, which is very common to happen in the elderly, we need to look after this by proper medication and seeing a specialist, orthopedic specialist maybe, to have physiotherapy sessions, which can be done at home as well as home exercises. Also, it is very common to develop chronic diseases like diabetes, hypertension or high blood pressure, ischemic heart disease, which is poor supply of blood to the heart, osteoporosis, which is frailty of the bones, also urinary tract infections, which can be recurrent in the elderly, and urine incontinence, and other acute respiratory tract infections like flu or common cold or lower respiratory tract infections.
Yeah, so as we get older, all our systems, become a little bit weaker. And you mentioned something I think is very interesting and important, mobility.
Yes.
How important is keeping the mobility intact for your general health when you get older?
When we get older, keeping active, it can provide good support to the joint, and also it can exercise the muscles around our big joints like the shoulder, the hips, and the knees. Getting the wear and tear of the joints at a younger age, it can happen because of excessive use of the joints. So when we are young, it is neither good to, when I talk about excessive use, is running for hundreds of miles maybe, or hundreds of kilometers every month. However, when we get to an older age, kind use of the joint can to some extent preserve the function of the joint and allow us to maintain and lead good quality of life and good mobility for the rest of our lives.
So exercise, even though we say exercise is very important, and everybody knows that, but even that has to be in moderation.
In moderation,
it should not be exaggerated, and it should not be too little.
Exactly.
That is a very interesting and important point.
Exactly, yes, exactly.
What if we would say that eating patterns, and if we would introduce that into how it can affect our longevity, how long we live, and also the quality of life in a longer life? Is eating healthy important?
Yeah, of course. Elderly patients or elderly population, they always have their nutritional needs. And when we start at the younger age, before the age of 60, with eating wisely, like having the moderate caloric intake, having good amount of proteins, and having low-fat diet, this of course can help us and can prevent the development of other diseases in the future. And I'll give you some example. For example, hyperlipidemia, or high cholesterol in the blood. High cholesterol in the blood can be acquired because of bad dietary habits, and can be acquired also in families. It can be inherited in families as familial hypercholesterolemia, or in broad terms what we call cholesterol running in the families. So also diabetes, it can develop from excessive stimulation of the pancreas by eating a lot of calories, which stimulate the pancreas to secrete the insulin. So at an older age, we might suffer from our bad dietary habits when we are younger, and develop diabetes when the pancreas is exhausted in the future from eating a lot of calories.
So generally
eating in moderation as well.
Yes, eating in moderation. I think everything in moderation, right?
Yes. Exactly.
And I think that so as we are not old yet, when we're not old yet, we need to invest in our future and live healthy so that our older age is relatively healthy.
Exactly, and this is really possible. By maintaining a healthy lifestyle, diet, exercise, having our nutritional needs. This, of course, when we do this in our early adult life, it can preserve our health in the elderly. However, then some of the elderly might live in isolation, okay, and this might affect their nutritional needs. So they start to develop some deficiencies. These deficiencies might affect their health. They might develop some anemias, like anemia means low hemoglobin in the blood, and the hemoglobin is the molecule which carries the oxygen supply to all the body organs. So when someone develops anemia because of bad dietary habits or if not getting nutritional needs, this of course can cause affect the quality of life and affect and if we can call it like unhealthy living or aging unhealthy. So by getting our nutritional needs, maintaining personal hygiene, getting a good amount of rest and sleep, having regular health checkups, medication management, and management of our nutritional needs, this of course can lead us to live longer and healthier.
When you're talking about health checkups, I'm thinking you're basically bringing up the point of screening.
Yes.
What can you tell us about screening?
Screening, generally speaking, is a way where doctors can detect disease earlier and thereby help in managing them without or before the development of any symptoms or signs. So if we can give a few examples of screening, for example, screening for diabetes. So HbA1c, which is a blood test done and has been adopted in the healthcare system, is a good indicator whether the patient is at risk of developing diabetes or not. There's a term called the pre-diabetes, and this is the target the target population which the physician needs to keep an eye on, and these are the patients which are the risk of developing diabetes. So if you identify pre-diabetes at a very early stage, this can lead the physician to give more advice about health education, diet advice, exercise, loss of weight, etc., to prevent to develop diabetes in the future.
So if you would be, if somebody would measure your HbA1c in the blood, and they find that it's elevated, then will the doctor give you dietary restrictions?
Yes. Under 6.5, it's considered 6.5 level is considered as pre-diabetes, definitely. So by getting good advice without the use of medication yet, though you can still use medication like glucophage in pre-diabetes, but by giving the patient good advice and education about exercise, diet, physical activity, and weight management, definitely we can prevent the progression to diabetes. This can happen. And I'm talking about type 2 diabetes, which is different from type 1 diabetes, which tends to develop in a younger age, and the patients tend to be dependent on insulin requirements.
Okay, and I think that, as times change and we have new technology, is it a little bit too much if I say that nowadays you don't always have to go to the doctor? You can actually consult your doctor without physically going to the doctor?
Sure, exactly. When we get older and with the advances of health medicine, our life expectancy increase. So definitely the elderly population all over the world, the number is increasing. So to maintain good access of this target population to the healthcare system, the traditional method of seeing the doctor face-to-face and physical examination is, I won't say taking now a back step, it's still the first and the most recommended one, but there are other methods of seeing a physician, and I'll talk about, for example, telemedicine. So simply if someone with chronic diseases and suffering from diabetes, ischemic heart disease, hypertension, and they only need the medication, okay, they can simply book a telemedicine consultation with the physician who has access to the records. He will look at the medications, he will make medication review, he will look at the last labs or last blood test done for the patient, and then decide whether it is safe to give the same medication to the patient or not, or whether he will need to invite the patient for an appointment, maybe to check his blood pressure if the blood pressure is not done at home by the patient. And this will prevent the patient coming to the hospital.
So telemedicine is good for, let's say, checking up on something which we are already familiar with, but it's not so suitable, or maybe even screening, getting just a basic idea of the complaint and deciding if the patient needs to come or not, but it doesn't really replace the doctor's visit.
Yeah, it will never replace the doctor visit, of course, but it has played, if you remember, during the COVID pandemic, and the telemedicine platform, the remote healthcare platform, has taken a precedent over physical consultation, and this was mainly to reduce and prevent the spread of the COVID virus, and this has played really a vital role in maintaining and preserving and prevention and reducing mortality or death among the elderly population.
And do you find that perhaps for an older population, this technology might also be a little bit more difficult to use?
This can be, but we can find patients now, they don't live alone. They might live with their carer, they might live with the family. So you can simply get the consent of the patient, okay, that in their presence over the phone, they can speak to the family as well. And if the physician is satisfied that he can finish his task over the phone, that will be great. If not, there are other methods like home visits. We can be triaged to a physician. He can do the home visit and go to see the patient by himself. Also, some patients, they might have poor mobility on wheelchair. So if the patient healthcare needs is managed over the phone while keeping the patient's safety, this will be all, of course, good, yeah, to the patient and to the system as well.
Yeah, another thing I was thinking about is that when we got older, at a certain point in our lives, we might find it more difficult to retrieve things from our memory, and that memory loss or let's say weaker memory might become even more progressive, and it might even go into a state which we commonly know as dementia.
Yes, exactly. A dementia in broad terms is like impairment of cognition or someone's ability to lead a normal quality of life, recognize surroundings, recognize the people he lives, thinks the same way as he used to think when he's younger. And this can be due to several factors. It can be, the most common, as we know, is what we call Alzheimer dementia. All right, and this can be related to a certain process where our cortex in the brain is not functioning as like it was in the past. People getting strokes or what we call transient ischemic attacks or poor supply or death of the part of the brain, they can develop another type of dementia called the vascular dementia. Even depression can lead to some types of dementia. Of course, early detection of the cause of the dementia, it can help not to prevent because it's a progressive process, but it can slow the progression of the disease.
Yeah, that is very challenging for the patient himself, especially if they are aware that they're progressing into that state of mind.
Sure.
But also, of course, for the family, it's a big challenge,
sure,
and very difficult to deal with and to handle it.
Yes, of course.
As we go more and more towards the future of healthcare, what do you think is going to be the role of your specialty, family medicine? Is it going to change or is it going to remain the same?
Yeah, that's a very good question. Thank you. Ideally, patients will need to have their own primary care physician who will be the first point of contact for them when they need the healthcare system or when they have any healthcare needs. We call the primary care physicians because they are placed, they are the primary care record holders who have access to all the patient records, whether it's a local access or remote access with other healthcare facilities, and they know what the patient medical history, the last visits, the medication he's taking, and. So the future is that the primary care physician will be the first point of contact, and the patient, when whether the elderly or in adult life, want to see or seek medical advice, they can either call the physician or go to see the physician face to face, and then the primary care physician should be able to manage and treat more than 90 or 95% even of the problem. They will only refer, if required, to a secondary care physician when needed. And I'll give you an example. A patient, for example, who is coming to see you with swelling as a surgeon. And me as a primary care physician, I did find that the patient has got a hernia or protrusion of part of the gut through a weak point in the abdominal wall. Then I thought, no, this hernia, there is a risk that the patient will develop complication. Me as a primary care physician, I won't be able to treat it, and I will need the expertise of someone like you. So I'll tell him, I diagnosed you with this condition. It is not in my own hand. I can treat it. It might be treated by conservative measures, but I think there might be room of surgical intervention. I'll refer you to Dr. Tariq. He will assess you. You will discuss the case with him, and then you will take it from this point, whether you will need a surgery or not.
Wonderful. I really think that you give us a wonderful walkthrough through family medicine in the modern age, and also taught us a lot about getting older and the challenges it brings, what we can do to do early detection, which is screening, and how having a healthy lifestyle style when you're at a younger age can make your older age easier.
Thank you.
Thank you so much for sharing your expertise with us. It was a wonderful conversation.
Thank you very much, lovely. Thank you. It's a
Thank
pleasure
you,
to see you
Doctor.
as well. Thank you.